Hello, my name is Dr. Rachel Limbrey. I'm a consultant respiratory physician. I'm here today to show you how to use the INNOVA Antigen Test Kit. This is a piece of equipment that we're going to use to look for the SARS-CoV-2 virus, which is the virus that causes COVID-19. Essentially, if we detect this in your sample, it likely means that you're infectious at the present time. Now, this piece of equipment, it's a rapid point-of-care antigen test. Now, let me show you inside the box. So it's a very simple test to use. And in fact, there's not an awful lot of equipment. And we can see inside, I'll walk you through what we've got. There are some straightforward instructions. Then we have standard swabs. These are swabs you're going to use to swab the nose or throat, for example. Then we have what's called extraction solution, which we're going to use to help extract the antigen from the sampling. Now also we're going to use these what they call extraction tubes, which are rather like mini test tubes, and they're particularly soft. They're very soft, squidgy and squeezy for helping mix the antigen with the solution. Also in this little bag, we've got some small nozzles with a tip on the end. We're going to use that towards the end once we've used our sample extraction tube, and we're going to use that little nozzle placed on the top to put a few drops of the solution into the antigen test cartridge. This test is terribly simple to do, as we're going to show you. We would normally expect a result between 15 and 25 minutes. And this is what it looks like. Now, so you'll see on here there are two letters. The C is going to be where you're going to expect to see a control line. Should you get an extra line, which is parallel to the T, then that would imply this is a positive test. Now, let's talk about sampling. So what we're looking to do is to sample the respiratory tract. It's within the respiratory tract that the virus lives. So it's different parts of the respiratory tract that we're able to sample. Now, we can sample a number of different places. We can sample the nose. We can sample the back of the throat. Indeed, we can do what's called combination sampling, where we sample the throat first and then the nose. We can also sample sputum. There are also other methods in the pipeline. We're going to show you today how to do the nasal sampling, the throat sampling. We're also then going to go on to show you how to actually use the equipment, exactly how you do it, in what order, and then show you the result as it unfolds. Right, so before we actually take any samples, we want to get ourselves prepared. Now, I've set up as I'm doing it by myself. So the first thing I've done, I've opened up the cartridge here, and you can see I've just simply labelled it. For purposes of this film, I've just literally written demo. And the other thing to label would be the swab. And you also want to just loosen that so you can use that quite straightforwardly. Now, the next thing to do is to pop some extraction solution in the extraction tube. Now, this is the little tube I mentioned at the outset. It's like a small test tube, very soft and squashy. So into this little squashy test tube, I want to put 6 drops of extraction solution. Right, so that's in preparation. So as I'm by myself here, I've just used a little sort of universal sample container actually just to hold everything, just so I can get my hands on it. Right, so the next thing I'm going to do is actually take my sample. Right, now we have a patient where we can show you how we're going to do the combination throat and nasal swab. So thank you very much for coming to help us with this demonstration. Would you mind starting by taking your mask off for me? We're going to start with the throat and then go to the nose. Now, before we actually start the swabbing, if I may, I'd like to show the camera what the back of your throat looks like with a bit of light on it. So if you can just pop your head up just a fraction, poke your tongue out and say ah. Now, what you can see at the back of this young man's throat is a double arch right at the back there. And that's where we're heading our swab. We want to get some good area swabbed under both of the arches and then also the tonsillar bed, which is just at either side. Okay, thank you for that. So you know this may make you gag. I'm afraid that is very normal, but hopefully it won't last for very long. Okay, so if you can open your mouth wide again, poke your tongue out and say, ah. I'm just going to swab first that side, then the other side. I'm so sorry, you're doing brilliantly well. Bit of tonsillar bed as I come. Wonderful. Well done. Take a big breath. Well done. Then next we're going to go for the nose, and ideally we'd like to do both nostrils. And I can see it's made your eyes water just in the back of the throat. It's very common when we do the nose. Again, it's uncomfortable, but it doesn't hurt, and it might make your eyes water for a few moments. Right, so have you caught your breath?
Yeah.
Right, well done. Pop your chin up for me. So I'm just going to go down and back until I hit a little resistance, so I know I'm actually properly inside the nose, no more than 2.5 centimetres or an inch, and then I'm going to gently rotate so I can collect some cells from the mucosa that's the lining of the nose. And then, in an ideal world, I'd actually like to sample both nostrils. Right, so we're going to start with this side. So down and back, bit of resistance, gently, gently twiddling it round. Well done. Okay, catch your breath. Well done. Then I'm going to go down the other side, gently, gently back, bit of resistance, and twiddle it round. I can feel little. Right. Super. Well done. Catch your breath.
Not bad.
Good. Right, so I've collected my sample. So I now need to find my little test tube. And then you'll see I've put the swab in there, and I want to agitate and squeeze and squash the swab on the wall. I'm also going to use my hands here to squeeze as I rotate the swab to really try and make sure I get as much antigen or bit of virus that may be in that swab, in that sample. So probably 10 times is sufficient. Now, just as I finish, I'm going to give the tube a little squeeze. So I'm squeezing the head of the swab as I pull it out to milk out any fluid there. Now, just for safety, I'm going to pop that swab back in there. And then the cap here has a little nozzle on the top. And then I'm going to add 2 to 3 drops from here into the well of the cartridge. We would expect to read it within 25 minutes. In reality, it's often very much faster, often 5 minutes. Okay, so here you'll be able to see this is a good negative result. We have a clear line at the C, nothing further down, nothing at the T. So a valid test with the control line there. One other thing to mention, just very occasionally with the sampling, when the sample's popped into the specimen well, there can be a bubble or two there. Just think perhaps to give a little tap on the bottom just to disperse that small bubble. And finally, another thing that we found is that if you're undertaking this test as part of mass screening, 3 people is the optimum number for a speedy flow through. So 1 individual to undertake the administration, so labelling of the specimens, putting the timer going, another individual to be undertaking the sampling, and a 3rd individual to be able to take the sample, pop it in the test tube for the agitation, and then undertake the actual test in the cartridge. Thank you very much for listening.